Bechtel, and just wanted to welcome you all to the Prove Tabula Rasa webinar, where we're going to discuss how to improve member contact data to improve engagement. So let's get going. So quick housekeeping items to start things off. If you have a question, please click the Q&A function at the bottom of the screen at any point in time. We'll probably save most of our questions till the end, but at any point, if things arise, please enter them there. And if you need a recording for this, don't worry about taking furious notes. We'll be sure to send this out after the webinar. So let's start off with introductions. So first, again, happy to be here. Thanks so much for taking the time. I'm Mike Bechtel, Vice President of Healthcare for Prove. I've been with Prove for 2 years, but I've been in healthcare my entire career. Started off my career in hospital administration and moved into healthcare IT about 15 years ago with a focus on patient and member engagement. So it was, I didn't know much about digital identity when I entered Prove a couple of years ago, but it was really a natural progression based on, sort of my passion for engaging members, engaging patients to be more active participants in their care and ultimately improve outcomes. And so when I learned about Prove, I quickly saw the value that Prove could offer to the marketplace and helping do just that. So really excited to be joined by Kevin Boesen, Chief Sales Officer of Tabula Rasa. Kevin, want to introduce yourself?
Yeah, thanks, Mike. My name is Kevin Boesen. I'd also like to welcome everyone here and appreciate you taking the time to listen in. I'm Chief Sales Officer for Tabula Rasa HealthCare. I'm a pharmacist by background, and I've spent the last 15 years developing med management programs that really focus on helping patients who take multiple chronic or complex medications. And a core component of that is a call center model that now has grown to 8 regional call centers with about 800 staff that's doing outreach to patients, providers, pharmacies, collaborating with pharmacies to try to address the growing challenge of drug-related morbidity and mortality. So I'm very excited to be here to present a little bit more about our company, the success that we've had working with Prove, and I'm really excited to share that with you.
Thanks, Kevin. Appreciate it. Great to have you here. So for those of you who don't know about Prove, quick introduction. Prove is a phone-centric digital identity company. That's a mouthful. But what we mean by phone-centric is we leverage the intelligence and the information behind the phone to ultimately prove identity and enable organizations to have more trust in who they're interacting with when that person's not sitting right there in front of them. And in this not quite post-pandemic, but post-COVID world that we live in now, obviously that's more important now than ever before. Traditionally, I think we're all used to, what you're seeing on your left hand of your screen, where when you're trying to prove who you are online, you have to enter a lot of information, potentially being asked arduous knowledge-based authentication questions, such as, what boat did you own in 2004? And all of this creates a lot of friction and ultimately a barrier for engagement within the healthcare consumer. And moving forward, it's really not necessary. Not only is it not necessary, but it's not necessarily secure either, as this information is more readily available to bad actors. So what Prove does is our approach is unique in that we focus digital identity based on the phone number, and has a lot of other byproducts, such as improving the ability to reach out and engage healthcare consumers. So Prove is in use by over 1,000 enterprises across the globe. We are actually in use by 9 out of the top 10 US banks, so very well established in the financial services area, and in the last several years have made a ton of momentum within the healthcare area as well. Next slide. Kevin, want to give a little overview on Tabula Rasa?
Yeah, Tabula Rasa is a really innovative company. We're a health technology and services company, primarily in the pharmacy space. We've got a great footprint supporting health plans. There's several hundred health plans that we provide technology and services for, as well as community pharmacies. About 18,000 community pharmacies use our technology, really to focus on addressing the issue of medication safety and drug-related morbidity and mortality. It's the problem we're trying to solve is it's estimated that about for every dollar we spend on medications, we spend another dollar dealing with the harms that medications cause. And so currently that's about $500 billion a year of things that we feel are largely preventable. We have a large precision pharmacotherapy and research and development institute located in Lake Nona, Florida. That's really the back engine of our science. And what we've done is rethink about medications and how they interact within the body, where historically when people would take one or two medications, you'd go to the pharmacy and see how those two interact with each other. It becomes much more complex when someone takes 5, 10, 15 different medications, really understanding, can the body process those at the same time? Can they absorb them at the same time? And a lot of those conflicts with the medications result in adverse drug events that lead to hospitalizations, emergency room visits. So through technology, we try to prevent that. But a big component of that is also the engagement of the pharmacies, the patients, and the providers to intervene to prevent those problems. So the technology can help identify it, but really it's the solutions that we have to help prevent that. So we offer a number of different solutions through community pharmacy consultations and a large telephonic component of our program to support disease management programs, value-based contracting programs, and other services across the healthcare spectrum.
Great. Thanks again, Kevin. So I'm going to start off by just kind of talking about the challenges with inaccurate member data. So, when we refer to phone-centric digital identity, obviously that requires a phone number. So, of course, there's a challenge in the market of actually maintaining those phone numbers. And Kevin, actually, you're probably better versed at this than I am in the challenges of receiving accurate contact data from the plans and from your clients.
Yeah, we see this as a challenge, and it's been a consistent challenge over the 15 years that we've been trying to provide services, is that a lot of health plan related information for phone numbers, addresses are inaccurate or just missing. So our strategy over the years has really been to find other places where that data may exist. Community pharmacies may have a little bit more timely or accurate information than the health plans have, or the providers might. But even in those cases, we find that patients are using multiple pharmacies, online pharmacies, mail order pharmacies. And so it's sometimes tough to get accurate information. And I think what you guys have done at Prove has really been a game changer at helping us increase engagement.
Great. And I'll talk a little bit about sort of how we do what we do. I always think it's important to understand a little bit of the background, and then we can talk about the solutions that are derived out of there. And of course, ultimately the results that Tabula Rasa has received. So, how does this phone-centric identity work? It really comes from a variety of data sources. So we're looking at things from the mobile network operators, meaning that's your Verizons, AT&Ts, T-Mobiles of the world. We're looking at risk factors that are associated with the phone. So phone line tenure. So this is not just how long have I been a Verizon member, but this is actually based on Prove's data sources, able to look at how long have I had this phone number, and potentially I've changed carriers throughout that time. And Prove has the ability to sort of see beneath the mobile network operators and look at from the core telephony network, look at the longevity of how long I've had this phone number. And all of these are risk factors that go into bad actors, potential account takeovers, et cetera. What's the behavior on that phone? Has this phone made texts and calls, received texts and calls, or has it been inactive for 2 months? Again, another practice of bad actors, of fraudsters. And looking across phone number changes, phone line changes. So all of these signals can indicate specific risk factors, and Prove's unique ability to see these risk factors kind of play into judging the trustworthiness of that phone number. And looking at, of course, that's great about the phone number, but who's ultimately behind that phone number? So this is really where it comes into the identity proofing component. And these data sources span credit reporting agencies, banks, utilities, and our own phone identity network, which we've amassed identity tokens for over 90% of the US population. So meaning that when I say identity tokens, that is anonymized tokens that ultimately bind the phone number to the PII, to that personally identifiable information behind the phone number. But it is in a privacy preserving platform, meaning that it's tokenized for proof. So proof, it's an anonymous hash token where we're tracking that binding of that phone number to that owner. And all of this kind of goes into our methodology, which we call PRO, possession, reputation, ownership. So this is really our methodology of how we ultimately prove identity and are able to maintain that within our phone identity network. So we look at, again, 3 things, and these vary based on use cases. And really for the use case we're about to talk to today, it's focused more on the ownership pillar. But again, thinking it's important to kind of understand the foundation for this. So we look at the possession, so something you have. This is what makes phones so great at verifying identity, is because we are in possession of the phone that we're on. We're obviously interacting with it and somehow, or we're interacting online where we should have ability to check our phone to confirm possession, that we are in possession of the phone that's being owned. So we're all used to one-time passcodes that come through SMS texts. Prove actually has the ability to do this in a passive way. So we have the ability to link up into the mobile network operators and actually in real time say, is Mike Bechtel in session right now with this device? Alternatively, we can do things like SMS-based possession checks, such as an instant link, where all you do is click the link on your phone. We do one-time passcodes, but those are quickly going by the wayside as they are susceptible to interception. The second piece we look at is the reputation of the phone. So it's great you're in possession of this device that has this phone number, but can we trust this phone number? And this goes back to what I mentioned in the previous slide, looking at line tenure, looking at line activity. Was there a SIM card swap that occurred in 4 a.m. on Saturday morning? Maybe that's a sign of an account takeover. So do we actually trust this phone number that we're basing this identity on? And the third component is ownership. So this is not as simple as saying whose name is on the phone bill, because I know for an instance of my family, my wife owns our family plan. So I would show up as my wife's name, not as my own. What this is looking at is the strength of association of you to your phone number as the consumer to their phone number across all of those variety of data sources that we mentioned in the previous slide. So those banks, the telcos, the utility companies, the credit reporting agencies. And all of this that comes back to saying, how strongly associated are you as an individual with this phone number? So those 3 components are how we prove identity. And that ownership piece specifically is really what came into play for Tabula Rasa HealthCare. Next slide. So just going to talk through a couple applications of sort of this background of what I just mentioned. So the first application is digital onboarding, meaning when someone is establishing themselves as a registrant of a digital account. So most commonly in healthcare, this is used within patient and member portals. So again, traditionally, I think that screen earlier where we have to enter all that information to enable us to digitally identify ourselves has been used historically. And the pass rates, as which the rate which you pass through successfully with that process is unfortunately very low. Historically, it's less than 65% across most Fortune 500 companies. What Prove Prefill does for digital onboarding is starts with the phone number. So again, based on that phone number, we're making sure we're checking that possession and checking that reputation. Can we trust this? And do we have data on this phone number? Again, which we do for greater than 90% of the US population. We'll then ask a challenge question. So it can be last 4 of social, it can be date of birth being the most common within healthcare, just to confirm that we are, again, looking at the right person. And what we do from our data sources is pool the accurate contact information. So name, date of birth, social security number, full address, all of that can get pulled from an authoritative data source. So you're not only ID proofing someone, but you're also ensuring accurate data entry all in one fell swoop without the consumer having to take action. And this is very popular. Over 93% of users who are given this option tend to choose the pre-fill their applications. Most don't require any data changes, although that can be built into the flow. And ultimately, what you're doing is you're reducing that abandonment, that drop off of users as they're signing on to things, removing friction and helping improve the ability to get them started on their digital journey. So the next phase is the segment is what we refer to as consumer digital servicing. So this is the binding of that phone number to that PII, so to that personally identifiable information, and then monitoring that on an ongoing basis. So Kevin talked about the challenges of accurate contact information. This is really what our phone book solution does, is we're verifying existing information that you have, but we're also finding additional numbers that you may not have. Most commonly, landlines are very popular for people to enter in with employers. Those get passed on down to third parties like Tabula Rasa. However, those mobile numbers often are not entered in. So what Phonebook can do is find those additional numbers that are associated, and the use cases are abound. For consumer phone number management, again, this is really what we're here to talk about with Tabula Rasa. It can be used within the call center. So as people are calling in, you can improve that caller ID match rate to increase personalization and also automate authentication as they're calling in. For member and patient outreach, most importantly, you can find better phone numbers and more accurate phone numbers and maintain those accurate phone numbers for outreach to engage consumers. And then, of course, general communications, making sure you're knowing the intelligence behind the line type. You know that it's a mobile number that you can text versus a voice number that you need to call. And then this can also be used on the digital side. So when we talk about digital identity, we're talking about both from a telephonic perspective, but also from a mobile and a web perspective as well. So this can be used for logins to make sure you're authenticating folks. It can be used for high-risk events such as password resets. So there's a lot of automation and a lot of self-service that can be enabled via Phonebook. So I'm going to hand it back over to Kevin to talk a little bit about their results.
Yeah, thanks, Mike. I used to think that it was extremely important to have a family member that was in healthcare so you could go to this trusted source. I am so excited that I have a son studying cybersecurity in college right now, because every time I hear you dive into this deeper, it's just an amazing world, and you need to have a trusted source of information. So I've got you, and now I've got my son, so I appreciate that. I mentioned this a little bit earlier, that the challenges and the problem that we're trying to solve relative to helping people prevent or avoid preventable hospitalizations, emergency room visits that are drug related. And it becomes an increasing challenge and a growing problem, because currently about 42% of US adults take 5 or more medications, and adults taking 7 or more medications have an 82% chance of experiencing adverse drug event. We have technology that can identify who those folks are and the ability to intervene in a way that can prevent problems if we can get a hold of them. If you go to the next slide, I'll talk about our use case initially with Prove. We've been working with Prove for a little over a year now. They've been a great partner for us. And if you look at a number of our contracts, this is an example of where we work with a health plan to identify patients at risk for medication-related problems. We identify somewhat of a high level of those taking multiple meds, have multiple chronic conditions, and a high drug spend. In the Medicare space, this is a required medication management program. And a benchmark for success is really, can you engage 90% of the patients or more that you've identified within this group? And as we mentioned previously, in some cases, accurate phone numbers only exist for about 50% of the population. So we have the other 50% that we really want to try to reach everyone and need a way to do that. And Mike's 100% right in terms of some of the data that we have is a landline that maybe hasn't been used in years. I have one of those every time I check in at my doc. They're like, hey, is your contact information correct? I see that landline number. I said, yes, this is correct. But I honestly don't have a phone anymore. I couldn't tell you how to check my landline voicemail even. So the ability for us to be able to have another source outside of the doctor's office, outside of the community pharmacy that we're working with, to try to engage these patients is incredibly important. So last year, we wanted to see how well this could do, and we sent 40,000 records to Prove. We were able to get 80% or almost 90% of those matched up with accurate phone information, and it increased our overall engagement rate by 20%, which is amazing for all the effort that we've done to try to find reliable sources. So huge opportunity to engage more patients and have a truly meaningful impact.
That's great. Thanks, Kevin. Yeah, and you guys have been a tremendous partner to work with this use case with us as we're kind of exploring the additional value of the phone intelligence and leveraging it for improved engagement rates. So just to wrap up, and then we'll go to some Q&A. We have a couple questions that are there, but kind of from an overall takeaway perspective, again, speaking a little broader than just the outreach component, but ultimately, I want the message to come across that people need to consider the phone as an omni-channel authenticator. We really need to, as we focus on the consumer experience, the patient experience, the member experience. We need to be where they're at, right? And people engage across different channels. They, telephonically, digitally, via mobile. And oftentimes, and especially in my experience with Prove, these are done in silos within organizations. So the way you authenticate yourself on an app is very different than the web, is very different than the call center. The phone can be used for all, and it can help simplify the lives of the consumers as well as the lives of the people that are having to manage these tools on the company's end. We also want to make sure we're reducing the barriers for entry, especially for our older citizens who have more of a challenge sometimes passing through some of these identity proofing techniques. So the way we can remove friction, remove the need for them to take active participation and passively authenticate them, the better. We need to authenticate the person behind the device. So I work with a very large client who only blockades their portal with a simple username and passcode, which is obviously can be extremely easy to break into that or to hack into that. So authentication that's used when you're logging into banking apps, every single time you log into a banking app, chances are that's Prove in the background that's doing some sort of authentication or ID proofing, checking potentially that possession, that reputation, that ownership of that phone number. We really, healthcare needs to start to think about this as well, especially with the focus on keeping PHI safe. And then lastly, obviously, what we just spoke about here is there is all this intelligence and the ability to maintain phone numbers, find better phone numbers, but not just in a snapshot in time, but on an ongoing basis. So you can leverage that for improved outreach in addition to all these sort of inbound activities. So those are sort of the overall best practice checklist. And now let's go to a couple Q&A as we wind down here for our last couple minutes. So the one question is, do you need consumer consent to ping a mobile operator to see if the customer is in session on the phone right now, or to grab another phone number in the phone book that the consumer did not explicitly give you? So that's a great question. No, you do not need consumer consent for passive authentication, for mobile authentication to passively authenticate you. So that is something that we do without consent, is just checking that the phone number is actively in session with that consumer at that point in time. And then the second question is, do you need consent to use the phone number for outreach? Now, this is actually a really good question. So the TCPA, Telephone Consumer Protection Act, does dictate within healthcare that implied consent is needed. So not written consent for marketing purpose, but implied consent, meaning that if you gave your phone number to your employer gave it to your health insurer ultimately passed to Tabula Rasa for outreach, that's implied consent. That number can be used. Implied consent is required when you do automated outreach with a phone number. So when you are reaching out with an auto dialer, when you're texting people, that requires that implied consent. For numbers that do not have implied consent, such as the numbers that are discovered by Prove, there's no restrictions for manual outreach. This is what Tabula Rasa does. So their pharmacists are on the call, on the phones, using those numbers to engage with their patients, and then obtaining that implied consent when they're engaging with those patients or with those members. However, they are restricted to put those into an auto dialer or to start texting those numbers without that implied consent. So the answer is somewhere in between, where yes, you can use it, but only under certain circumstances.
Yeah, Mike, there's a couple other questions here that have come in. One is related to the percent of health plans with bad or missing contact information, and the other is what is our most recent experience been. It depends a little bit on the health plan. And I would say, Medicare plans have a little bit more reliable information in some cases. Let's say Medicare Advantage is more reliable than some of the standalone prescription drug plans. It has to do with some auto enrolls that patients can get. So you don't always have the patient themselves doing the enrollment in some of the plans. And so you don't get the accurate information. So it continues to be something that we see as high as 50% of a patient population without information. And so it's we had a really good experience with our initial pilot. So obviously we've expanded that. This year we've probably requested close to 200,000 or more numbers and contact information. And probably what's additionally helpful is in some cases we'll get multiple phone numbers for an individual. So it gives us an opportunity for a couple different options as far as outreach and engagement. So we've been able to successfully scale the program. It's easy. We get the information when we need it via an API, which also makes it much more convenient as well. So very excited about the current state and how it's working for us.
Thanks, Kevin. Just on our question, how often is the phone book updated with information? So the phone book is in real time. We do have different methodologies of working with our customers. We started off in a batch file fashion to get started quickly with Tabula Rasa when we did the proof of concept, and then moved to an API real-time integration where at any given point in time, you hit the phone book and you can obtain the latest and greatest number. And kind of a follow-on question to that I saw was, do we work with landlines as well? So the answer is yes. We verify both, all line types, so landline, mobile numbers, VoIPs, non-fixed VoIPs, and then we also append, meaning that we discover those types of numbers as well. And again, all that information is provided within phone book, so you can see the line type, what type it is, knowing that this is a non-fixed VoIP line versus a mobile number. Generally mobile numbers are the best to get in touch with people. So I know that Tabula Rasa prioritizes reaching out on mobiles before other line types. And I mentioned a little, let's see here, another question on, I think the most recent experience of the case study. I think, Kevin, you mentioned that, and just a little bit about the partnership between Tabula Rasa and Prove and how it's unique in the healthcare space. So, within the healthcare space, we've been, here for the last couple of years, have secured a dozen organizations or so as clients. But Tabula Rasa's relationship has been really great for us, really strong, as they've helped, kind of partner and hone the value proposition of member outreach via phone book. So traditionally, it's really been more of an authentication tool for inbound engagement, both digitally and within the call center. But within healthcare, the value proposition of having better phone numbers for engagement has really taken off. And Tabula Rasa was our inaugural partner in helping work through some of the workflow issues. So it's been a great partnership since the beginning.
Yeah, I would echo that. It's been a great partnership, and definitely look forward to many years to come. It's helped us quite a bit, and it's definitely helped the patients we serve quite a bit.
Absolutely. Well, we're over time. So I just wanted to thank everyone for attending as well. Again, thank you so much for your time. If you have any questions, again, you'll be receiving an email with a recording of this. There'll be information on how to contact us via that. But you can always go to tabularasa.com or prove.com and look around the website and contact us that way as well. So thanks so much, everyone. Have a great rest of your week. Appreciate it.